Hello everyone. I have a different video for you. This time is about blood disorders, and we're going to cover basically blood disorders that we cover in the adult course. So iron deficiency anemia, aplastic anemia, and polycythemia. Before we get started with iron deficiency anemia, I'm going to cover like just general, basically must know points about anemia. So, what is anemia? So, pretty much anemia is a blood disorder that could be as a result of, we're going to call them three or four things. So, either the deficiency and the number of red blood cells or the quantity or quality of the hemoglobin. And let me refresh, the hemoglobin is what carries the oxygen molecule, or the volume of these packed red blood cells that we commonly call that the hematocrit. There's different causes that can lead someone to anemia. One of the most common one is like blood loss. It could be from trauma or just simply they just were in a surgery and so now they have post-surgical anemia. Or it could just simply be an impaired production or the destruction of the red blood cells. This should be equal. The body should produce enough and it should destroy enough, and it should be in an equal balance. Anemia is diagnosed with a simple blood test of CBC, where we look at the red blood cells, we look at the hemoglobin, and we look at the hematocrit. Um, Typically, we can see if someone is anemic by these three, especially the hemoglobin. That's the one that we really look at. And then, yes, there is different diagnostic exams that then we determine what kind of anemia it is. Okay, so what do clients experience when they have anemia? Well, really, the manifestations really depend on how quickly blood is lost, how bad is the blood loss, and also any coexisting diseases that the client might have. There are different levels, and so we talk about mild, moderate, and severe. I have here listed the levels. So for mild is 10 to 12, moderate is 6 to 10, and then severe is less than 6. When we go over the manifestations, I want you to think about what happens when someone has low oxygen and low volume, like blood volume, because the manifestations are going to get a little easier if you think about those two things. So, for mild anemia, someone might not even have symptoms, they might not even recognize it, but they could experience some palpitation, shortness of breath, and fatigue. For moderate, you'll still have those palpitations, shortness of breath, and fatigue, but at rest. They don't have to be moving, they don't have to be doing anything, and they feel them. Now, for severe, you can have all the previous one, but take it a notch higher. So you'll have big tachycardia, you'll have tachypnea, you'll have lethargy and fatigue, you'll have paleness, pallor, especially paleness in the conjunctiva, and then the dizziness and cold. The tachycardia, dizziness, comes from low volume, like low blood pressure. When we have low blood pressure, your heart is going to pump higher, or it's going to be, well, not higher, we're going to call it faster to make up for the low volume that we have. And dizziness as well, okay? All right, so then how do we treat general anemia? And these are just general, okay? We're going to assess the cause and treat it, fix the problem, and we're going to monitor these vital signs constantly just to see how better or how worse the client is getting. We're going to transfuse blood, especially if it's below 7. If it's below 7, in the hospital, we transfuse patients. Now, some patients get transfused at 8, but they have to be symptomatic, okay? if they're not symptomatic and that let's say they have a hemoglobin of 8 or 8.5, usually physicians don't order a blood transfusion. We're going to supplement some oxygen. They're lacking that hemoglobin that carries the oxygen molecule. So we're going to give them a little bit of oxygen to help them. We're going to warm them up because usually they complain of coldness. And we're going to give them intravenous fluids, which is going to help with the circulatory system and kind of give volume in the vessel. Okay, so now let's go and move up to iron deficiency anemia. So iron deficiency anemia, it's still an anemia, but we have here a decrease in hemoglobin and iron levels. So pretty much we need iron to make hemoglobin, and we mainly get iron from foods usually. And so, if someone is having difficulty with eating, like malnutrition, or maybe homeless, or someone that is drinking a lot of alcohol and supplementing, so to speak, food for alcohol, as well as reproductive years in the women. Because, for example, pregnancy, like the child just basically eats all your nutrients. So, yeah, these are causes that can lead someone to iron deficiency anemia. Now, one thing to put in the back right there in your notes, I have a picture here of the GI tract, and it's because um, the absorption of iron happens in the duodenum, and so these individuals that get gastric bypass or surgeries to lose weight, they basically suffer from anemia, and they have to supplement a lot of vitamins and nutrients because of that. Let's see. Another thing that I want you to know is that um, the production of red blood cells is basically driven by many nutrients in or vitamins, and so there's some key nutrients here that take a key role in the production of red blood cells. So if anyone has a deficiency on any of these, you can have trouble with red blood cells. So these are, and they're in your book in page 610. I want you to look at those. But they're your B vitamins like B12, 5, 6, and 2. You have your vitamin E, you have folic acid, iron, and vitamin C, and proteins. Okay, so how does iron deficiency anemia manifest on clients? Well, you can have all the symptoms of anemia that we previously discussed, but these are hallmark for iron deficiency. Paleness, especially on the conjunctiva, glossitis, which is that inflammation of the tongue. They get very beefy red and swollen like that. And then you have spoon nails. Instead of being curved out, they kind of curve in. So that's why they're called spoon nails. You could have paresthesia and headache as well. How do we diagnose anemia, iron deficiency anemia? I better say, yes, you're going to have a CBC that is going to tell you your red blood cells. You're going to have your hemoglobin, hematocrit. But here, key is to differentiate iron anemia. It's your iron levels. Also, there's these three tests that we do: ferritin, in TIBC, and transferrin. So ferritin is this protein in the blood cells that basically contains iron. So it helps the doctor understand how much iron the body is storing. The TIBC, it's a blood test to see how much or too little iron is in your blood. So they're similar, but they kind of tell the doctor different things. And then the transferrin is that specific iron transporter protein in the blood. So we want to see, well, maybe we don't have the protein transporter. That's a problem. So they basically take out all of these to figure out where is the problem coming from. They're table 36 of your book. All right, so um, in addition, they could take blood samples for bilirubin, which is it's a test that kind of says if your blood cells are being broken down by your body. And so again, it should be a balance. It should be production and destruction. If we're breaking them down and destroying them fast, your bilirubin is going to be higher, your B12 and folic acid. In addition, they could do a colonoscopy or an endoscopy or in a cold blood of their stool to see if maybe the bleeding is coming from an ulcer or cancer of your intestine. And worse to last is a bone marrow biopsy to see if maybe perhaps this is your bone marrow acting up and maybe have other conditions such as cancer of the blood. All right, so now that we know that it's iron deficiency, then what do we do? Well, first, yes, we're going to identify and treat the underlying cause, but we know it has to do a lot with iron, okay? And so we need to educate our clients to eat foods that are high in iron. In page 610 of your book, you have a table there that talks about different foods that are high in iron. I'm also going to show you a couple of options here. So basically, we just tell them to eat a high iron diet. Now, here's the thing with iron. It's one of those nutrients or medicines, especially if we're supplementing it orally, that can be problematic and cause trouble. I call them problematic and troublemakers because they cause side effects that patients don't like, and then they stop taking it. So iron is one of those. And basically what it does is that it causes GI upset, from heartburn to constipation, and sometimes diarrhea, but constipation is the most common one. It also turns your stool greenish, like dark green and almost black. And so it's very important to educate the clients like, hey, this is part of the medication. Don't get scared. Doesn't mean that you're bleeding, because they relate a dark black stool with blood, like basically losing blood in the GI tract. Another thing to tell them is that because it causes severe constipation, they need to be taking stool softeners, a laxative, maybe some fiber included in the diet to help with the constipation. It must be taken 1 hour before eating in an empty stomach. It likes it in a acidic environment in order to be absorbed. So not only do we take it before eating in an acidic environment, but also we take it with vitamin C in conjunction with it. So all these points are very important to teach the client. Now, some people don't tolerate PO and they just, don't take it. So one way of handling that, or if your anemia is severe, is that we can give it IV. Now, to give it IV, the problem with this is that you have a higher risk of an allergic reaction. You have to make sure that your IV is placed in the correct vein, and that you don't have, let's say, a bad IV, because then all that dark solution gets leaked everywhere. But yeah, worst case scenario, we just also transfuse the patient as well. Here's some most common and kind of easy to look at for my visual learners. Some of the foods that are high and rich in iron. However, look at them. They're potatoes, broccoli, spinach, peas, and beans. You have liver. You have red meat like beef and pork. You have seafood, and so what comes to mind when you think about these foods? Well, how about people that can't eat any animals, like vegetarians? Or maybe people that have allergies, or maybe these individuals that don't eat any vegetables and fruits. They don't like it. So we have to, when we recommend clients what to eat, we have to consider their allergies, their culture, if they can't eat pork or not, or any special diet that they are following, and try to give them options around those. Okay. Um, for example, like liver, a lot of people don't like liver, it's not a very tasty or commonly food that individuals eat. So if you tell a client, oh yeah, you got to eat liver now twice a week, they're going to be like, no, I don't think so. And so they're not going to follow the diet. The good thing is that you can always supplement it. All right, so now let's move on to aplastic anemia. This is basically just like this picture shows here. It's a problem in the bone marrow that produces all these cells, and basically you don't have any of the cells, any of the three main components: platelets, red blood cells, and white blood cells. Now let's think before I even go into the explanation. I told you that anemia has a problem with red blood cells, and then you had all these symptoms. So if my bone marrow is not producing my red blood cells, then what do you think my symptoms of aplastic anemia could be? Yeah, it's going to be basically no oxygen, the lethargy, the paleness, the tachycardia, tachypnea, and all of those. Now, but then on top of it, you don't have platelets. Platelets stick to each other to prevent bleeding. And so if we don't have platelets, we can bleed. And then if we don't have white blood cells protecting us from the immune system, we can develop infections. So I hadn't even explained to you what aplastic anemia is, and you probably could figure it out. So it's a decrease in all of your blood cells. We call this pancytopenia. And basically, you have a problem with the oxygen, your immunity, and coagulation. And we have a problem in the bone marrow. The bone marrow, it's bad, okay? And it's not functioning accordingly. So pretty much these manifestations could take days, weeks, and months. It's not something that it's like one day to the other. You have all the symptoms of anemia. You have that fever, not feeling good, can contract infections. You can have from the bleeding petechiae, which are those little points that I'm showing in this picture, bruising, nosebleeds, etc. We diagnose it by taking blood. Okay, CBC can let us know white blood cells, red blood cells, platelets, hemoglobin, hematocrit. We can take an iron level just to see if it's differentiating between iron deficiency. But really, the key diagnostic test here is going to be your bone marrow, because on your bone marrow, you're going to be able to tell that it's not producing the cells that it needs to. So how do we treat it? We treat it with supportive care for the symptoms. So supportive care for pancytopenia. And if it's red blood cells, then we are going to transfuse blood, or we're going to give them, more iron. If it's new for the white blood cells, the individual doesn't have any immunity, then we put him in neutropenic precautions. And neutropenic precautions are basically you don't allow the client to get many visitors. They have to wear masks. They can receive fresh flowers, fresh foods, lots of hand hygiene. So pretty much we're trying to prevent the client from exterior germs, viruses, and things that can attack the body because they don't have any immunity to fight it. We can also give them antibiotics if they're sick, any antipyretics if they have fever, and so on. For the platelets being low, what we do is that we teach them to be careful, like not use razors and shavers that can cut them. be safe, like basically making sure that they don't fall, report any excessive bleeding, etc. But ultimately, really, what we're going to do here is that in order to fix it, we have to get a bone marrow transplant. Well, to get a bone marrow transplant is something that you have to be matched with someone that has the same components as you. And so it's not something that I just go to the store and I buy. You have to be on a list, you have to qualify, you have to match. And so it can take a little bit. All right, so the next one is polycythemia. And just like this picture here shows, you have a bunch of red blood cells, bunch of them, and they're all together. And so here, poly comes from many. And so that's going to be your key, many, poly. So the problem here is that not only do you have red blood cells, but you have white blood cells and platelets. Polycythemia is it's kind of subdivided into two. For adult, we cover primary polycythemia. And so in primary polycythemia, you have the three components of the blood. So red blood cells, white blood cells, and platelets are super, super, super high. But in general, polycythemia is just an abundance of the red blood cells. Now, what happens if I have lots of red blood cells in my vessels? Not only that, but I have platelets and white blood cells. Yeah, it gets sticky. It gets sticky. It gets viscous. Your volume is going to increase, and that's problem. That's a problem because then you can collapse or deteriorate your blood circulation. And that's where the problem comes in. It comes in because when we have all these red blood cells and platelets, the individual is at risk for clots. Okay. And so that's where we're going to see a lot of the symptoms, and we're going to prevent. So how does it manifest? Well, manifestations are due to the high level of viscosity and volume. Volume, let's talk about volume. You can get headaches. Volume increases blood pressure, okay? So we have headaches, we can have dizziness, ringing of the ear, we can have visual disturbances, and all of that has to do with volume. In addition, because the bone marrow is producing immature red blood cells, not quite developed, the body breaks them down, and sometimes they're even damaged. So the body destroys these red blood cells. So you have an elevated uric acid, and so they also have like itching and can develop gout. From the viscosity and the risk of clots, you can have angina, you can have heart attacks, you can have stroke, or just simply blood clots in the body. So those are very important to remember. Also, from the volume, you can have heart failure. Okay. And the bleeding here, don't think I'm like, well, Miss Bertala may say that I have lots of platelets. Why would I be bleeding? Well, no, the bleeding comes from the too much volume. It just kind of explodes, and the vascular capillaries, they just get very permanent, and so you start bleeding. You can have nosebleeds, etc. So that's where the bleeding comes from too much volume. Again, we diagnose it with hemoglobin, platelet, just a CBC. You're going to see that the red blood cells are small. You could have erythropoietin either low or normal, but here again, we're going to see a bone marrow examination. To treat it, you have to handle basically the volume and the viscosity. So the volume, we can remove the blood by phlebotomy. and we do this every other day up to 2 to 3 months. The viscosity, we want to thin it out. We want to make sure that it's not as sticky and as thick. So we can do hydration, just pump some fluids, and also oral, and prevent the complications, which are the clots. And so for that, we do antiplatelets such as aspirin or clopidogrel, which is commonly known as Plavix, and they prevent the platelets from not sticking to each other. For the uric acid elevated, we do gout medication called allopurinol. And because we know is a issue with the bone marrow producing extra amount of cells, we can tell not the immune system, the bone marrow. We can tell the bone marrow, hey, slow down, don't produce too much. You're going crazy. And with myelosuppressive agents, and one of the common one is Hydra. Okay, well, I hope this was helpful and just a quick review on blood disorders, and I will see you in the next video. Bye-bye.